Welcome back to the second part of the show, and standing by with me we have Tony Wood, who will be engaging in a short while as we discuss matters healthcare in the country. And just to recap our Twitter poll question, today we're asking you, do you think access and the cost of drugs in Kenya is overpriced? Do you think access and cost of drugs in the country is overpriced? Well, do send us in your feedback using our Twitter handles at KTN News. You can tweet me at Agina Abi. Remember to use the hashtag KTN Business as we delve deeper into matters healthcare. Well, the cost of medication has been one of the talking points for many Kenyans who have been arguing that they do not get value for money. Well, let me kick off this conversation now. The cost of healthcare in the country with Tony Wood, the Managing Director at MyDawa, one of the innovations that continues to disrupt how the healthcare system in the country. And thanks for making time for us.
Thank you very much for inviting us.
And Tony, just picking off from our question where we are asking Kenyans whether they think the cost of medication has been overpriced or not. I just want to on this.
I think the question necessarily isn't is the cost of medication overpriced? Is the cost of medication affordable to the population? And that's an issue. We've got many global manufacturers who are selling their products in Kenya, and some of those are very heavily subsidized. Some aren't. So I think the point is that mainly drugs tend not to be as easily affordable as they could be. But that's not just an issue for Kenya. That's an issue that seems to be being raised in parliaments and in governments across the globe.
Interesting. And one of the biggest undoings for the African market, of course, has been an informalized healthcare system. And it's an opportunity for innovators, especially when it comes to seeing the opportunities in the marketplace. Perhaps talk to us about how do we formalize the healthcare system to ensure that there's equality, there's affordability, and there's predictability?
Well, I think there's huge steps now being made towards that with the fact that universal health coverage is part of the President's and the government's Big Four agenda. It's very firmly in the forefront. And I know the Ministry of Health have been out talking specifically about the cost of medication, etc. And really looking at how the public sector and the private sector can work together to make healthcare in general far more accessible. But I think one of the things for me that's very important, and why you're seeing so much innovation happening, is there are only so many healthcare workers, whether they be doctors, whether they be pharmacists, pharmaceutical technologists, clinical officers, nurses, community healthcare workers, whatever cadre it is, there are only so many of them, and we have to make them far more efficient to be able to do an awful lot more with the same or slightly growing resources. We must make them more efficient.
All right. So where do companies like MyDawa plug into this big conundrum?
So for MyDawa, it's very, very straightforward. I mean, we're at the fulfillment end of the healthcare cycle, shall we say, from when patients go and visit doctors or a prescriber or where, and then come looking for their medication. So we're at that fulfillment side. And for us, it's been very much about gaining efficiencies so that we can make sure the price is affordable, making sure that our platform is accessible to Kenyans. There's no point in having great affordable medication if people aren't able to access it. All right. So those are the two areas that we've very much focused on. And what we've tried to do is gain efficiencies from the supply chain. For many years, people have been complaining about supply chain costs, etc. Again, it's not just in Kenya, and it's not just in pharmaceutical products. It's across the globe. So you see an awful lot of supply chain streamlining, disintermediation happening globally, and we've just kind of caught on to that and made sure that we were able to do that for the drugs and for the medication and for all the other kind of health and wellness products that we carry. And by doing that, we've simplified that supply chain. That's allowed us to be affordable in terms of our pricing to patients or to consumers. And it's also allowed us to guarantee the quality of our products.
All right.
Because patients are able to authenticate every single product that's purchased through MyDawa.
Mm-hmm. And how big a market is it here in Kenya? And are you seeing opportunities to innovation across East Africa?
I mean, I think the market in general in Kenya, the drugs market from both the public and the private sector is probably close on to $1 billion in Kenya. No, we're certainly not looking at all of that, but we do think that we can make an impact in the areas that we're looking at, especially in terms of retail, in terms of those who are out of pocket, and are incurring those expenses for those who are insured. We're also looking to support the insurance companies as we go forward. But absolutely, Kenya is where we've started because. And really, we chose Kenya as the first country because of the ease of adoption of technology. Kenyans are very quick to adopt technology. The pervasiveness of mobile money in terms of payment makes an online solution very, very suited to the Kenyan market. But we absolutely are looking to take this not just across the whole of Kenya, but across East Africa and beyond.
All right. And from a strategic outlook, where do you see MyDawa, especially when it comes to deepening especially in the country?
As I said, I think our objective is to simplify that supply chain. That means that products are consistently available. So if we manage that supply chain end to end, we can get a consistency in price and make that affordable. We can get a consistency of availability, so we can try and avoid stockouts. Stockouts are sometimes an inevitability, but if we can really work through that whole supply chain and do proper demand generation, we can understand that to make sure that we have products in place before people need to have them. Because unfortunately, it's when you run out of a product, that's when patients have a substitution where they get a different product rather than perhaps the one that the doctor or the prescriber prescribed. So what we want to do is make sure we have a consistency of that availability also. And by doing that, it gives us an opportunity to make sure we have a consistency of quality. Very good quality.
Perfect place to end the conversation.
Okay.
Many thanks, and we definitely be keeping an eye to see how the application continues to perform in the market and sort of streamlining the healthcare system. Okay. Many thanks, Attorney, for that, and of course a lot in relation to the pharmaceutical sector